Hey, Jim Hoffman here from EMS Office Hours. This is your Monday Minutes. Guys, thanks for joining me for another episode here. And I'm hoping they're helping you with your studies, with your review, getting ready for an exam, whatever the case may be. And we're going to continue on today with head and spinal trauma, focusing on neck injuries. But I want to, of course, always remind you guys that if you're looking for more content like this, stuff that can help you pass exams and get ready, go check out the Turbomedic Insider level membership. This is a free level. You can get gigabytes of content there, practice exams, exclusive access to the members area, and also hours of video and audio. And I'm always adding new content all the time to this membership, so it's always growing with members and additional content. So again, I want to talk about neck injuries, guys, but before I do, always like to try to mention why this stuff is important, right? Because while it's gonna help you pass exams because it's key information, it's not just for your exams. It's also designed to help build your knowledge base and make those better clinical decisions out in the field, write better reports, and even interact more effectively with other healthcare providers, whether it's your partner, a nurse, a doctor, whatever the case may be. So keep that in mind, guys, because it all kind of ties in together. And I hope, of course, while you watch these videos, if something is not ringing true to you, if you're confused, that you will open up your textbook, another review guide, look at Turbomedic, something like that, to help you really master the specific content that you might be struggling with. So we talk about neck injuries, guys, and today I'm really talking mainly about the anterior neck trauma. Okay, and this is the injury to the base of the neck, and it really carries the highest mortality rate. You think about the major vessels that are there, the major organs and structures that it affects, right? The spine, cervical spine, lung, stuff like that, right? So when we talk about the potential injuries, right, we're talking about things like injury to the airway, the esophagus, lungs, trachea, having an airway compromise going on, your major vessels that could be affected, right? Laceration of a major vessel, they can bleed out, right, very quickly, okay? And you can have, again, a significant compromise to the airway as well. And I want to mention here, guys, esophageal tears, which can happen as well. And you can get that subcutaneous emphysema, you can get some hematomas in the neck as well, oropharyngeal or nasogastric blood going on, and nasogastric blood, we can have this sort of reflux going on where the blood is coming back into the airway, back into the upper airway, and that can be a high mortality rate. So positioning is important, and a lot of times positioning at a semi-followed position can help prevent reflux to begin with. So just keep this stuff in mind when you have a patient with a anterior neck injury like this, okay? Okay, so when we're assessing these patients, guys, we're looking for, of course, signs and symptoms of shock, major active bleeding going on, hematomas that might be developing, tenderness to the area, crepitus to the area, right? Deficits that could either be a pulse deficit or even a neuro deficit. So some things to look for when you're assessing a patient with a neck trauma, neck injury, especially an anterior injury. When we talk, like I said in the beginning, this high mortality rate, keep an eye out, be aware of the things that could be going on that could be affecting other structures, other areas of the body, and causing your patient to have major issues. Now, real quick, guys, our treatment for this type of stuff, of course, we're treating for shock. We're securing the airway. We're controlling the bleeding. Maybe we're going to be giving IV, giving fluids to these patients. There's not a lot we can do. We can't suture, right, out in the field, right? So we can't manage deep injuries if, let's say, that the trachea is involved or the esophagus is crushed and affecting the airway, right? So rapid transport's going to be our key thing here to get going to the hospital, right? So do what you got to do on scene. Get that airway secured and start moving, okay? You can treat for shock, you can give IVs, you can control bleeding on the way to the hospital, okay? So get that done. Let the hospital know what you're coming in with so that they're ready when you get there. And of course, you want to transport to whatever appropriate facility. And guys, don't forget, follow your local guidelines, your local protocols, so that you know when you have a patient with a trauma injury to the neck, what resources are available to you, what you're allowed to do, what you're allowed not to do, okay, and what hospitals are available to you to actually transport the patient to. So again, guys, very basic stuff here. Trauma is often very basic, right? But I think it's key information, and like I said earlier, if you're not getting it, if this doesn't ring true, you're not quite sure how to treat for shock for a patient like this, you're not quite sure how to control bleeding for a patient that's got an injury to the neck, look at your guidelines, open your textbook, delve deeper into it. Okay, these videos are supposed to be short and sweet so that you can get the highlights that you're going to see on an exam, kind of ring bells in your head as to what it is you need to be doing. But if you need to go deeper, get a deeper dive into this stuff, open that textbook, use a resource like TurboMedic, some other online resource, whatever you're comfortable with, and delve deeper into these topics, okay? All right, guys, that's it for me. Again, guys, if you want to join me in TurboMedic, I encourage you, go check out the Insider membership. It's free, okay? Now, it might be free in your wallet, but like I say before, I've said this in other videos, it's not free on your time, on your effort, okay? And I respect that. So when I'm sending you this website to join as a free member, I want you to take advantage of the content there, all right? So go check it out. You can do it very easily. Go to emsco.com/insider. There's a link in the show notes as well. Go check it out. Join as an Insider member and get access to this content. All right, guys, that's it for me. As always, I am Jim Hoffman from emsco.com. Stay safe.